Hey everyone, about to start my Q&A. Just before I do, tiny reminder that this is not medical advice and to always consult your doctor before changing anything in your routine. Is 36 years old, almost 37, too old to get pregnant? So absolutely not. It is not too late to get pregnant. This is a common misconception in terms of age and fertility, but I cover this actually in depth in Module 2 of Conscious Conception. My bigger question would be, how are your cycles right now? How are your other markers like digestion, skin, hair, nails, sleep, energy, temps and pulses, etc.? So just because society has its own definition of fertile doesn't mean you're too young or too old to be fertile. If you're fertile, you're fertile. And what's more important is what that means for you as an individual. So to answer your question, no, it is not too late and you're not too old. Recommendations or tips for a mom who has to go through C-section to have a better postpartum experience. So C-sections are major surgery. Sometimes they're unavoidable though. So you have to do the best that you can without knowing enough about you as an individual. So there are two main things I would suggest. One, listening to your body, and two, taking it easy. Surgery is definitely harder on the body than a vaginal birth would be. So you'll have to prioritize these things more so than usual. I would also recommend prioritizing skin healing foods and tissue healing foods because of the incision that you'll have. So these include vitamin A rich foods like liver and high quality dairy and high quality oily fish, as well as vitamin C rich foods. So check out my posts on all these vitamins that I'm about to say, but those include citrus and tropical fruits, acerola cherries, camu, things like that. You'll also want to prioritize copper rich foods because copper plays a huge role in our infrastructure. So those include things like mollusks and liver and vitamin C rich foods. And then you'll also want to prioritize collagen rich foods, which include bone broth and things like stews with the ligaments and tendons. So really eating nose to tail. And so that's kind of what I would focus on without knowing more about you, but best of luck. What are your thoughts on using topical progesterone when nursing? I think this can actually be an amazing tool. It just depends on you as a person, how you respond to it. Sometimes taking progesterone while you're nursing can diminish your milk production. So you just want to be mindful of that and pay attention to that as you introduce it to your routine. Because if your goal is to continue breastfeeding but your milk production starts to diminish, you want to find that right balance for yourself. I would work with somebody qualified. Working with a lactation consultant can also be a really, really big help. I'll tag somebody here that I trust who's also pro-metabolic. Do you think home birth is possible after a history of preterm birth, 24 weeks, and 2 C-sections? So I do. I think, what would be more important is just trying to focus on nourishing the body, replenishing the body, fortifying the body so that you can put your best foot forward. But if I were in your position, I would also be curious as to maybe looking into and trying to trace back what the cascade of events was leading up until the preterm birth, leading up until the C-sections, especially if, for example, the C-sections were not something I specifically wanted to happen, and trying to work on any areas of opportunity that I might find. And I should say it's important to be curious, but it's also important to give yourself grace because pregnancy can be such a black box sometimes. Sometimes things are just completely out of our control and we have to go with the flow. And so just allowing yourself to give yourself grace and also not dwell on what happened in the past. So enter this future pregnancy in a new light and treat it as a new opportunity, and to make sure we cultivate the right mindset. Not that I'm saying you're not, but when we've gone through these experiences and they're things that we didn't want to happen, there can be some fear, there can be some, reservations, there can be some self-doubt, and to really try to hone in and quell those things so that we can enter this new phase in full force and full throttle. And despite the things having happened in the past that may not have gone the way you wanted to, your body was still made for this and you absolutely deserve to have the birth that you want in specific situations. But I also think there's a lot of misconceptions, and I cover this in depth, and I also do a deep dive into breaking down the ritual prenatal pros and cons in my course, so check it out. middle schmers, lots of info on pain management, but not on preventing suggestions. So I actually have a post dedicated to this. I would also check out my free cycle literacy guide in the link in my bio. And I also cover this in depth in Conscious Conception, my e-course. And just in case any of you are like, what is middle schmers? Middle schmers is middle pain in German, and it refers to the pain that you get while you're ovulating, so ovulation pain. And you can actually feel the egg being released. It's normal, but it shouldn't incapacitate you. So I'll post the post that I did on the next story. And don't forget to check out the free guide in my bio, as well as the course, which we have a whole module on cycles. What are the top things to do to avoid preeclampsia? So this is definitely an interest of mine. I was a preeclampsia baby, but also my mother had preeclampsia with 2 out of 3 children. And my brother, who was the second baby with preeclampsia, he had to be delivered very early because my mother was very sick with preeclampsia. So I definitely take this to heart. Generally speaking, preeclampsia is elevated blood pressure during pregnancy, but it can develop into full-blown eclampsia, which used to be called toxemia, and it's also known as HELP syndrome, which is hemolysis, so the destruction of red blood cells, elevated liver enzymes, and low platelet counts. So that's kind of the definition, and it could lead to potentially liver and kidney damage in the mother, and worse, death of the infant. Another potential association is convulsions or seizures in the mother. So now that we've gone over what it is, to understand how to prevent it, you have to understand what causes it. There are several things that can be traced back to preeclampsia, and let's try to break them down. So one is stress. Stress is going to raise our blood pressure. If we're constantly stuck in a stress state, we're going to have high blood pressure. And if not managed well, that can advance into worse things. Stress also depletes us of vital nutrients, whose deficiency can also be traced back to preeclampsia. So just a few of them are sodium, magnesium, B vitamins, protein. So both micro and macronutrients are super important for this, as well as balancing blood sugar. Making sure you're getting the right ratios of carbs, proteins, and fats can help reduce the stress in the body, and it can also take burden off of the liver. I'm not done yet though. There's a hormonal component too, and hormonal imbalances can usually be driven by stress and or nutrient deficiencies too. Even though we covered this at a very high level, as you can see, there are many factors when it comes to preeclampsia developing, and there's no one specific magic bullet that you can take to prevent it. Having a strong foundation going into pregnancy can be absolutely pivotal, and honestly, it's why I created my course, Conscious Conception, to help women build that foundation and to put their best foot forward going into pregnancy. And even more selfishly, to help women not have to go through what my mother went through, but also to help their babies, like myself and my brother, not have to go through what we went through. All right, so we're ending on a very personal note. My phone is about to die, so that's all I have time for right now. I will try to answer the rest of the questions today or tomorrow, but I am traveling with family, so it might be a little more difficult for me. Either way, I will try to do another Q&A next week, and thanks for tuning in. Bye.